when I developed the augmentation mastopexy, I was trying to correct for the problems of previous lifts with implants. And those problems were, one, a durable result with a limited scar. I wanted to minimize the scar while making sure that that scar didn't get too wide. And what I'm talking about is many of the circumareolar incisions, the incisions that are only around the areola, were one, very wide, two, they flattened the breast, and three, they tended to widen the areola. So I wanted to minimize the widening, I wanted to enhance a minimal scar, and I also wanted to make sure that my lift was without any tension and it wasn't flat. So that was step one. Step two is I didn't want to have this wide upper pole, and I also wanted to have fullness in the upper pole. A lot of the other techniques which push from the bottom do not even pay attention to the upper pole. In some cases, what they would do is they would get these teardrop-shaped breast implants, and those would try and add fullness to the upper pole. My experience was that those things looked very fake, and they were also very difficult to work with. Those implants that were in the upper pole, sometimes they would rotate a little bit, and all of a sudden you would have asymmetry. When I lift the breast and I reshape it to create the teardrop shape, wherever I put that tissue, it stays. So it looks good, it's durable, and you don't have these patients come back in 3 weeks saying, my upper pole fullness has flipped or moved, which is what you get with those implants. So those are the reasons why I developed this particular technique.